Deep brain stimulation surgery can be performed in a variety of different ways. Here at Portsmouth, we use a frameless technique, which means that the patient does not have to have a large, heavy frame affixed to their skull. What that does mean is that the patient comes in for multiple stages of surgery. First, the patient would come into our office for consultation and to kind of review the pros and cons of surgery. Next, the patient would come back for what we call fiducial placement. So this is putting very small markers into the patient's skull. This is a very quick procedure. Takes usually about 10 minutes. Once that's performed, we get imaging of that patient, and then we allow that patient to go home. While that patient's at home, we're looking at the imaging that we just obtained, and we're calculating the target for stimulation based on the location of these markers we just put in the skull and the locations that we expect to be able to deliver stimulation. That allows us to develop something called a stage, which is then custom made for that patient. That process takes about a week. The patient then comes back the following week and goes to surgery. This surgery is kind of the main point of surgery for this patient. The patient goes to the operating room, is awake for surgery, has this stage connected to those markers that we'd previously implanted, and then we use this stage to target the place that we would like to stimulate. The leads are placed but are not yet hooked up. The patient stays in the hospital overnight and is able to go home the next day. And then now we get to the third week where the patient comes back. We re-access those leads, we tunnel those leads, and we connect them to a small battery that goes into the chest wall, much like a pacemaker. The reason that we don't do all of that all in one stage is that would make for a very, very long day for that patient. Furthermore, that second stage, the patient needs to be awake for us to be able to evaluate them during surgery. For the third stage, we don't need the patient to be awake, so it's nice to be able to break the two stages apart and allow one surgery to be done with the patient awake and one surgery with the patient under general anesthesia for comfort.